Everyone, thanks for joining us today for this quick preview of the PASCV fall meeting. First COVID, then monkeypox, and now we all need to start looking for poliovirus in wastewater. Has there ever been a more important time to care about clinical virology? Well, we've got an all-star clinical virology cast to help us preview why you shouldn't miss the fall meeting. We have Dr. Hiba Mustafa from Johns Hopkins University, Dr. David Gaston from Vanderbilt University Medical Center, Dr. Caitlin Otto from NYU, and Dr. Ben Pinsky from Stanford University. So we'll start with Dr. Mustafa. In a few sentences, tell us what we need to know about this meeting. Where is it? When is it? And why should we not miss it?
All right, so the meeting will be in Chicago. It will start the morning of the 22nd, and it will close the 23rd at around 1:30 p.m. And this is a you shouldn't miss opportunity for everyone who is interested in quantitative viral testing. So for lab staff, for clinical fellows and providers, CPAP fellows, this is an amazing opportunity to learn from the experts about all what it takes to validate or verify a lab FDA-cleared quantitative assay, and also what are the major challenges in how our amazing microbiologists deal with them, in addition to multiple sessions that will help understand the clinical utility of quantification, which includes hepatitis and viruses of interest in transplant patients. And this year, we also have a poster session. We also have outstanding industrial workshops.
Great. And it seems like you've also planned some really nice networking breaks during the meeting as well as a happy hour. Anything you want to share about how folks junior or perhaps new to the field can benefit from these networking opportunities?
Yeah, sure. So for all the new microbiologists, this is actually a very unique chance to join a focused, small and interactive meeting, which will actually cover one of the most important clinical lab topics. It also is a chance for networking with leaders in the field of clinical virology, clinical microbiology, and industry. And if you actually didn't join our full meetings before, you should register this year. We promise this will be a meeting that you will always try to not miss each year. And this year, interactive sessions, it will discuss challenges that we face as we think about bringing in a new quantitative test, and how should the lab think about esoteric requests for quantification, like quantifying CMV from stool or adeno from CSF, and what is the actual clinical utility of these types of tests.
Terrific. On that topic, then I'm going to turn it right over to Dr. Gaston, who's going to be presenting in two panel discussions that seem very practical and applicable to a wide range of audience members. The first one is on verification validation of molecular quant assays, and the second, as Dr. Mustafa mentioned, is on esoteric requests for quant testing. And I don't want to ask you to give away too much of your talk, but can you tell us some of the most out there examples of requests you've had, like I need a viral load, a COVID viral load on my pet hamster?
Um, you bring up an interesting point on that part when we're thinking about monkeypox and how this is a zoonotic virus that is being transmitted from those with monkeypox to their pets, and in doing so is going to become endemic not only in human populations but also in animal populations outside of the natural range, or at least the historic range of monkeypox. So that's actually not that far off in terms of an esoteric request, one that could actually be actionable. Anytime that I and my colleagues deal with what I kind of think of are creative esoteric requests like this, it's always important to remember the spirit behind them, which is always to help the patient. And it's always to say, we've got someone who's ill and we're trying to find out what's going on. So how do we best go about that? So some of those requests, you're right, are for surprising viruses in surprising places. And it's usually our role to say, well, let's step back and say, what's the better test to be able to offer if we can't offer what you're asking for? Or can we do that in a research capacity and then ask larger questions about viral pathology, human disease, and et cetera. So we'll dive into some of that in the breakout sessions, and hopefully we'll make it interactive and quite fun.
Definitely don't want to miss that. So I personally enjoy these types of panel discussions because you can hear a variety of opinions and perspectives, and sometimes they can get, kind of fun and a little bit combative. So how do you think you all might differ in your approaches to validation or verification of a quant test? Because, there's a variety of interpretations there.
Sure, there are, and this is going to differ institution by institution. And I think that kind of dialogue is very beneficial to come together and say, how do we do it at Vanderbilt University Medical Center? How does Dr. Mustafa do it at Hopkins? How does Dr. Pinsky do it at Stanford, and others, to say how are other ways to do it? Because a lot of this is somewhat up to interpretation to the medical directors. And thankfully, in this field, you have a lot of friends and you have a lot of colleagues that you can reach out to. So those will be points of discussion, and maybe even say, how does this spin off to produce a little bit more literature about how to do this?
Great. Looking forward to it. So Dr. Otto, turn it over to you. You're the chair of the membership committee for PASCV. Can you tell us in a few sentences what is special about PASCV membership, and particularly as it relates to the fall meeting?
Yes, definitely. So, I've been a member of PASCV for a few years now, and there's a few things that separate PASCV, that differentiate it from other societies. There's a couple of things. I find that the membership group tends to be a really, really cohesive, collaborative group of people. And it's also very supportive of individuals across the spectrum, either from various levels of training or various areas of microbiology, whether it be industry, academia, clinical labs. There's a really good diversity of representation across the membership, and they tend to work really, really well. I also think in the context of these meetings, these individuals put together phenomenal meetings where the topics of the meetings are very practical. I always walk away from these meetings having learned practical tips that I can actually take back to the lab and put into practice in myself. And I find them to be very, very appropriate for what is going on. So, we were just mentioning monkeypox. These are issues that we are dealing with today in the lab. And PASCV, I think, is one of those frontline organizations that responds to these very high level, active topics. So, and it is these membership group, these members of this society that put this content together. And then the last thing I think I would say is just the networking opportunities at the meeting. So, I'm mentioning all of these individuals. Well, we always, as the conference and workshop organizers, always really make sure to have opportunities for people to connect and talk to one another. So if you're, say a fellow coming, somebody coming out of fellowship and you're looking for a job, there's always opportunities to talk to others. And if you're looking for research opportunities, collaborations, things like that, it's a great place to connect.
Awesome. Sounds like a no-brainer. Join the society, come to the meeting. So we'll turn it over to Dr. Pinsky, who is the editor-in-chief of the journal, of Clinical Virology, JCV, which is PASCV's flagship journal, as well as the president-elect of PASCV. So Dr. Pinsky, when I look at some of the recent JCV articles, many overlap with the content at this meeting. What do you want JCV readers to know specifically about the fall meeting, and why should it be of interest to them?
Yeah, absolutely. Thanks for having me on to discuss. JCV is the journal of the PASCV as well as the ESCV. And we have had a number of really interesting recent articles that cover viral quantitation. In the most recent publication, there's a paper from a Thai group from Dr. Brumenhent and colleagues looking at quantitation of CMV in plasma and BALs, which is a somewhat controversial topic, perhaps will be covered during the meeting. In addition, one of our speakers, Alex Greninger, on the second day of the meeting has a really nice paper on digital droplet PCR. In this case, for variant identification in CoV-2, but of course, ddPCR can be used for calibration independent quantitation of viruses in clinical samples. So perhaps he'll touch on that. So I think for readers of JCV, there's a lot of content both in the journal and in this meeting that will be extraordinarily relevant for your clinical practice and may also stimulate additional research projects and manuscripts that you could submit to our journal.
Fantastic. Well, this sounds like an awesome opportunity to learn some new content, network, and engage with an incredible society of clinical virology professionals. Any final words anyone wants to share about the PASCV fall meeting? Other than just show up, come, sign up. It's not too late. So thank you all again for your time, and thanks to the audience that's watching. And we hope to see you out just outside of Chicago on September 22nd and 23rd. Thanks.
Thank you.